It's a fast-moving situation we're in, and I want to take the opportunity just to say to people that they're reacting really, really well to what is a national crisis. People are rightly concerned, but it's also great that they're not panicking either. So what I want to take the chance to do is to say to people a little bit about what is COVID-19, what is it that we can do to protect ourselves, our families and our communities, and how can we go about doing our normal day-to-day, making sure that we have our medicines and that we're looking after ourselves as best we can. So for a start, COVID-19 is a virus that is spread from person to person, and what we see here in Ireland is we're now at the stage where people who are living in Ireland and have never been to one of those places where you could have been exposed to COVID-19, such as Italy or such as China, people are now transmitting it at the community phase. So it could be that somebody is able to pass it on to somebody else without knowing, because we have an incubation phase of 14 days. So in order to make sure that we're not passing it to one another, we can look after our own personal hygiene, and the recommendations that we have from the HSE that the best way to do that is to look after your hand hygiene. So we want people to wash their hands and to wash them properly, and the advice is there from the HSE on how to do that, with warm water and soap as often as possible. Also, if somebody's out and about and they have access to a hand sanitizer, that's a very good way to do it as well. When we think of how the virus spreads from person to person, it is most often going to be spread in droplets that come from your mouth or when you sneeze. So then it's really important for people, if they feel a sneeze coming on, to sneeze into a tissue, or if they don't have a tissue, is to sneeze into the crease of their elbow. So they're not creating a spray which is going to affect other people. What also then is important when we look at the advice that we're getting is, once that's done, is that it's really important to avoid touching your face, your eyes, your nose, and that's a lot harder to do than you might think. So we just all have to be conscious of that as well. And then, like any scenario when we're looking after hygiene, if we keep as clean as possible the work surfaces that we have, or in our own homes or workplaces and our kitchens, to be able to do that as well. So the people who are most at risk are people whose immune systems are already compromised. So that might mean somebody who's undergoing chemotherapy, that might be somebody who is taking medicines that lower their own immune and inflammatory responses, and also the people who seem to be most at risk as well are people who are over 80 years of age. So if there is some good news within this, is not everybody is going to get COVID-19, and of the people who do get it, it seems that 80% of people just have what you and I would call normal flu-like symptoms and don't need any further intervention than to stay at home, to stay hydrated, and to take medicines to lower temperature. There is, unfortunately then, 20% of people will need to have a medical intervention. Some of those will need to go to hospital and be monitored, and then a very small section of those may unfortunately end up in intensive care. There is even a smaller number of people then who will unfortunately pass away from COVID-19, and depending on where we look at where we are in the world, that can be for under 1% and in some instances more than 3%. Yeah, look, it is good news that the vast majority of people are not going to succumb to this. So it is still really concerning that this disease is in our country, but it's still within our own hands to be able to make sure that we look after ourselves, look after vulnerable people in the community by looking after ourselves. But then when you think of the picture a little bit more broadly, it's important then that we manage our health system, and it's important then that we manage the medicines within that health system. So if we look at the health system first, if you're somebody who feels that they might have the symptoms of COVID, that you may have been to one of those countries where COVID that I said has been prevalent, or if you've been in contact with somebody who may have shown the symptoms or has been to one of those countries, what it's important to do is to remember that you may be carrying COVID. Mm-hmm. It is most likely that you're not going to succumb to it as an illness, but what you must make sure you do is not waste the resources within the healthcare system. So the best way for you to contact your healthcare professional is to do it by telephone. That way there isn't that person-to-person contact that we were talking about earlier, and then assessment can be made of somebody over the telephone as to how serious the situation is. The other thing then to bear in mind is if we broaden that out a little bit and we think about that person-to-person contact. So take, for example, in the pharmacy here, if people get in touch with us via email, via telephone, or if we can ask them to use our app, we can get their medicines ready. So when they come to the pharmacy, we don't have to have them waiting in a queue. Everything can be ready for them, so that contact time is minimised. Also, if people need their general health care advice, they can also then get that from us over the telephone. And by doing that, we'll make efficient use of what we have, and we'll make sure that the risk of person to person is minimised. The way it is most likely that you would transmit it to somebody else is by spending more than 15 minutes with them, in contact closer than a metre, and also then if you're not washing your hands properly, or if you're coughing and sneezing, that you're creating a spray that somebody else could walk into. So that's the reason why we're emphasising, even for people who don't feel that they have any symptoms, that basic really good kind of housekeeping hygiene is so important. We are in what we would call a regular seasonal flu period of the year, which runs from September all the way up to the end of March or the start of April. So just because you may have some of those symptoms doesn't mean that it actually is Covid-19 that you have, but the sensible thing to do is to self-isolate with those symptoms, and then using the telephone numbers to get through to the HSE or to your own local GP, have that consultation with them over the telephone. I would say that the advice that's being given, I think, is very sensible. And I think that if people are in a position where they can work remotely, they can work from home, I think that's take the opportunity and use it. I think probably in the circumstances, the right decision has been made to close schools. But then we must bear in mind the knock-on effect that has then to people going to work. So for example here, what we need to understand is that when people are coming in the door, they understand that this is a different circumstance for us, and to have patience and to see what is it that I can do from my circumstance to make it easier for that person in the pharmacy or in the supermarket or in the doctor's reception to be able to look after me properly. I really like the phrase when we said that we can pull together by moving apart, and I think that's really important for everybody to bear in mind, that each and every one of us has a point to play. I think that we're in a position here, by everybody acting properly, taking the advice and acting calmly, that we can get ahead of this, and the worst effect of this disease that we've seen in other countries hopefully won't come to pass with us. The most important thing that we can do is to go back to our fundamentals, which is to wash our hands with soap and water, to cover our mouths and noses as we sneeze, to avoid touching our faces, and then also to clean as we go. To have hand sanitizer is a bonus because you don't need running water for it to use, but it isn't any more effective than using ordinary soap and water. So it probably is as much to do with how often you can do it rather than what's in it. Obviously, what we want people to do is to think that just because they can't get their hands on hand sanitizer doesn't mean that they can't clean their hands. They can. And then what we also then need to bear in mind is that if you say that I am going out and about today, try and make the most efficient use of your time, so we're avoiding that person-to-person contact. So if it's a case that you can telephone somebody ahead of time to say, please get such and such ready, or is such and such in stock, it saves that everybody walking around asking the same question. The latest evidence we have, Jenny, is that they are of no use. So as far as the masks are concerned, the only benefit that the masks are to people who have COVID-19 and are actually talking to somebody else, it may lessen the risk of a transmission, even though there still is a risk of a transmission. And secondarily, maybe people who are looking after somebody who is being diagnosed with COVID-19. Now, because of the numbers we were talking about earlier, that is very, very few circumstances in which they will be of any benefit. When we then look at the broader context and say, there is always a finite number of face masks. So if the wrong people are buying the face masks, the right people won't be able to get them. And then we need also to talk about people as they're trying to access their medicines. If we start to see people trying to stockpile medicines, what's going to happen is that your stockpile is going to actually put the whole supply chain out of kilter. So we have lots of medicine in Ireland, and we have plenty here for everybody. But if people start to panic and start requesting more than a month's supply of medicine, our advice is, from the HSE, which just came out this afternoon, is not to give people more than a month's supply of medicine, because that's how the system works on monthly refills. So that's important to remember as well, and we will not be making exception to that. If you want to be able to contact the pharmacy, using the app. It's one of those things then that becomes really important at this time, because it saves time and it saves contact time. So if somebody sends me their prescription using the app, I can have everything ready. Or if it's a case that it's a medicine that we need to order in for them and we might have in the morning, it saves a trip to the pharmacy to find out, do I have it in stock? So that's available here with us, and that's available, I know other pharmacies have them as well. But it just really is another better way maybe than picking up the phone or sending an email to say, can I do it? When it comes to the stock of regular medicines as well, we have lots, we're getting our daily deliveries. So there is really no cause for concern or panic about the stocks of medicines. We are part of the European Union, which is, it's got 320 million people. That's a big market, so we have access to lots and lots of medicines. What I'd like to say, Jenny, to sum up is that it's important that people realise that we need to be concerned, but it's our own actions are going to make a big difference to ourselves, to our families and to our communities. And really, if everybody can bear in mind the effect that things that they do can have on other people, their health, the supply chain and our ability to get through this, I think that we won't see the effect of COVID here in Ireland the way that we have seen it in China or in Italy if everybody pulls together.